time for an update. We're checking in with Putnam County and the Health Department. We've got the Health Commissioner, Rieman, with us today. We're going to find out what's happening there, especially with COVID. So thanks for joining us.
Thank you for having me.
All right, so give us an update. What's the situation with you guys in Putnam County?
Well, things are not where we would like for them to be. We can say that. Last week, for the week of January the 2nd through the 8th, we had 360 cases reported to the Health Department. So that does not include cases of individuals who maybe did a home test and didn't report that result to the Health Department. That 360 cases is higher than any week that we had reported in 2021 and is very, very close to our highest week that we had in 2020. So we're definitely not where we would like to be.
Right, exactly. So you mentioned reported cases. If people are taking that home test, do you want to know that they tested positive with those tests?
We would like to know if they did have a positive test. Of course, the important thing, though, is for them to do the steps that they know that they need to do to protect others. So to stay home. You know, the CDC changed the recommendations for isolation and quarantine, and for isolation they say you should stay home at least 5 days. If your symptoms are better, then you can go out and about, but you need to wear a mask for the remaining 5 days of your quarantine. So if people know what to do and they do those things, that's the first step, because our first step is always to want to protect other people from getting it, especially those loved ones in our lives who maybe wouldn't do well if they came in contact with the disease.
You brought up the mask. Let's talk more about that, because we are trying to get back to quote-unquote normal and do things, but wearing a mask is still important. And I think we're forgetting about that. We're thinking it's over and, you know, don't need to wear the mask.
We absolutely are forgetting about wearing our mask, and we need to bring that back. We need to do that because while it may not be 100% effective, it is effective in reducing the spread. And really in high incidence areas like we have here in Northwest Ohio, we're supposed to wear a mask in indoor areas, and I think maybe sometimes people forget about that. So when you are going shopping, when you're going to church, you know, we want to be able to do those things that we want to do. We want to be able to maybe go to a basketball game. Maybe we want to, like I said, go out to dinner with friends. And so, you know, do the things that you know. We have things in our arsenal. We have masks. We know that they're helpful. And if we want to continue living our lives and doing those things, we also need to take steps to protect us and other people.
Do you think we're getting fatigue and we're just over it? I mean, is that part of the problem, not only in Ohio, but across the country?
Oh, I absolutely think. I can tell you just in the health department, we're tired of it. So I think people are tired of hearing about it. They're tired of, you know, doing those extra steps to protect those people in their lives, but it's not done with us. We've said that before. We're all done with COVID, but COVID is not done with us. And now with the new strain, with Omicron, and the fact that Omicron can spread so very quickly, we need to button up again, and we need to do those things that we know reduce the spread. If not for our loved ones, do it for the individuals who work in the hospitals who are just being so overwhelmed right now. We need to protect all of those individuals.
Right, yeah. I mean, we are being overwhelmed in Ohio. I mean, the National Guard's coming in. President Biden's going to send federal troops and federal help. So it is here in Ohio, and we're seeing the numbers everywhere go up.
We absolutely are. We are not immune here in Northwest Ohio. Our numbers are high, and we just need to do those things. We need to, I hate to bring up flattening the curve, because I know some people didn't like that, but you know, we did that so that way we didn't have such high numbers all at once where our resources were being overwhelmed. And so, like I said, do we need to shut down businesses? No, but let's do those things that we know to do to reduce the spread.
And let's talk about vaccines, because I think Putnam County, you guys were doing really good at one time getting a lot of people vaccinated. Do we still need to bump those numbers up too?
Right. Vaccination is really one of our best ways out of this pandemic. And so we do have a nice number of people who are coming in for their boosters. And you're right, initially we had wonderful numbers in Putnam County. And our elderly, our most vulnerable population, we have a nice percentage of our elderly that are vaccinated. We would love to see our numbers increase, though. And like I said, getting boosters is important, but you know, getting some individuals to start that series, that really will help. And you know, individuals that are more likely to be in the hospital are those that are not vaccinated. And so You know, will sometimes people come down with the disease even if they get the vaccine? Yes, they might. But really what we want to prevent is that severe illness and the hospitalizations and unfortunately deaths that sometimes come along with that.
Right, yeah, because the hospitals and nurses, they're getting fatigued. I mean,
Yes.
they're getting so filled up.
They are. They are. They need some relief, and we need to do our part.
All right, so in Putnam County, you make an appointment or do you have vaccination clinics? How are you getting the vaccine out?
We are doing clinics every Thursday, and individuals can make an appointment. They also can go to the gettheshot.gov, I believe, and so they can go online and they could do it through there, or they can call the health department and we can make an appointment for them.
All right, well, Kim, thanks for coming. Thanks for the update.
All right, thank you.
All right, don't go away. We'll look at the weather forecast next.